We are here to talk about Startup Health Insights, our mid-year report, here with Troy Bannister.
And Unity Stoakes.
Great to be here.
Likewise.
Everything we're talking about, you can download our free report at startuphealth.com/reports. Just came out with the mid-year report. Huge quarter, huge first half of the year.
Biggest ever.
What's going on?
So we're looking at about $6.5 billion in funding for 2017 to date.
$6.5 billion in funding.
$6.5 billion, which is crazy. We've never seen funding this high yet. About $3.8 billion of which was the second quarter alone.
And this is in over, what do we track, over 300 deals? I think 306 deals?
Yeah, just about.
One thing to point out is we're looking at deals globally.
Correct.
We're also looking at deals that are at the seed stage, very, very early.
Yep.
All the way through Series B, C.
If we see a deal, we track it.
Very interesting to point out, because there's a lot of great funding reports out today.
Right.
And some people question, hey, why are the numbers different? I think what's interesting to see, the overall trends seem to be consistent.
Yep.
But again, we're looking at global and very, very early deals, which I think accounts for some of the differences.
I think we take a little bit wider stance too, in terms of looking at
what digital health
what
is.
digital health is according to our definitions.
What are some examples?
So I think Grail is a good example. It's a company that looks at liquid biopsies in the blood to find DNA that's shed off of tumors, so you can detect cancer at a really early stage. We count that as digital health. We see that as a machine that can analyze, biology and turn it into numbers.
And that's a major deal.
Right, it's almost $1 billion deal. Some people count it, some people don't. We think it's definitely digital health.
So what are some of the other big trends? What's going on?
Yeah, so one of the biggest trends out of the year, in my opinion, is kind of the rise of the big deals. We saw already in 2017 about 10 deals over $100 million, which is the first time we've seen it grow this much this fast. It's actually tied for the first with the biggest year ever in the past.
And these deals are happening all over. It's not just one region. They're happening globally in some cases, but also across sectors.
Right, and I think that's most noticeably in China. We've seen a lot of really large deals of the past year or so. The outlier on the sector side is patient education. For the first time ever, we saw Outcome Health raise a significantly large round, one of the biggest of the year, exclusively focused on educating patients in the doctor's office. I think they're in almost a quarter million doctors today that are using them, which is a big number of doctors.
Right.
And I think their plans with the funding raise is to spread that out even more. What they do is, I think, kind of a cool idea. It's a big electronic interface that sits inside the doctor's office, used to show patients what's going on in their bodies, what's wrong with them, and how they can really be champions of their own health.
It's significant to see funding go into so many different subsectors of digital health and come from so many different regions, right? So in the top 10, we've talked about big data analytics getting a lot of funding for the last couple of years, actually. Education, training, getting a lot of funding. I think that's the second category this year.
Yep.
But other areas, medical device. What are some of the other areas? We got workflow, research, population health. To me, this signals a across-the-board reinvention of the whole system because of technology, because of digital, because of innovation.
Yeah, and it's interesting. We usually see a couple deals, or a couple sectors at the top over and over again, but they churn a lot. And the thing that brings them up to the top is usually a couple big deals that rise them straight to the top of the list. But what's, I think, most important is most of these categories are getting 10, 20, 30 deals every quarter. None of them are left alone, right? Even EMRs, right? Epics, Cerners. This is being disrupted right now. We see Modernizing Medicine, I think it was the 5th largest deal of the year so far, is a new EMR system for the iPad. So we're already seeing, this really old legacy system that hospitals cannot get rid of, right? You can't get rid of Epic, but we're seeing these companies come up and try to push that out.
Let's see what happens.
Yeah, maybe this is a different
I've been talking about for a while now. It'd be interesting to see what happens if a company like an Apple tries to acquire an Epic and turn it off or do something interesting there. We've got an interesting chart here. It's called the Market Maturity Map. Describe this. I think it's pretty interesting. We're talking about
people love this map. Let me tell you,
different types of deals at different stages.
Yep. So what we're looking at here is we're trying to see what sectors are being funded down the road, right? At what stage? So if we see a lot of sectors being funded at later stages, then we can maybe presume that some of these sectors are more mature than others.
Right. So patient consumer experience, 9 seed, 8 Series A, 8 Series B. It's quite active.
Yeah. Typically it is. Patient consumer experience is usually at the top of the list. There's always a lot of deals. I think it's mostly because it's an easy one to make as a business. It doesn't cost as much as a complex personalized health company. Patient engagement apps can be made pretty quickly. So I think there's a lot of churn in that category. Plus, I think it's really hard to make a good one. I don't think anyone's really figured out patient consumer experience yet. I mean, we see some companies like Omada Health, for example, right? They're doing a great job with diabetes.
And they just had a big raise as well.
They just had a big raise as well. I don't even think they need to raise a huge round like we're going to see a lot of these other companies do. I think they actually have a good model that's generating good revenue right now for them as well. But I think there's a lot of people still trying to figure out this patient engagement thing. I heard a really interesting comment the other day. The best kind of patient engagement is no patient engagement. And I think people are starting to figure that out a little bit insofar as...
So it's designed invisibly into life.
People don't want to be thinking about their health and actively waking up and having to do activities around it. They just want to be healthy and happy. So I think companies are now figuring out that maybe less is more when it comes to this, and thinking creatively around how can we connect with the patient, work with the patient without them even knowing it.
Right. We're starting to see a lot of those technologies designed right into the car, right. Into the steering wheel, into the seat, and
with Alexa even, the Amazon Dot. There's a lot of healthcare companies popping into that space as well.
Very cool. So. Rise of the rest. We're seeing money come in, deals funded all over the world, but also all over the United States.
Right.
I think for the first time, Colorado broke into the top 10.
They did.
There's other areas like Minneapolis, Chicago, LA, Austin that are all garnering a lot of emerging new companies.
Yeah.
Talk about that a little. Why is that important?
Yeah, so we've spent a little time in Colorado, so we've kind of understood that this is a really blossoming ecosystem of digital health, and I think there's a lot more out there as well. But the fact that we have seen that very in person is pretty interesting to see how it works and who's involved and how complex and difficult it really is. But there are a lot of companies coming out of there that are doing really different things because they're in their own ecosystem with their own nuances and own challenges.
And it's just a great place for entrepreneurs to move. I actually just got back, spent the 4th of July there.
Yeah.
And what a great place to be, right?
Yeah.
You can understand why entrepreneurs, innovators are flocking there from all over the world. So it's cool. It's cool to see the rise of the rest. I think that's really important. One last thing I wanted to mention, we've had a lot of startup health companies raise money this year, and we're starting to see, we've got 200 companies now, and many of them are raising rounds, really active. Just announced a new deal with Baby Scripts, just did a raise, yep. Series A. CareDocs just announced their raise. But it's really great to see the diversity of innovation go on within our own family of companies as well.
Yeah, it's pretty interesting. We have a great sample size of companies that we can see, a lot, how do I phrase that? We have a great sample size of companies at StartUp Health that represent digital health in a way. So we get to work with the CEOs and really understand what's happening in this small sample size and kind of understand what that means for the entire ecosystem, I think.
And we've listed all of our companies that have raised rounds. So check that out, startuphealth.com/reports.